Welcome to Operation Healthcare Choice, Ask the Expert video series. I'm joined today by Joe Antos, a resident scholar at AEI for Health Policy and Retirement Studies. He's also a current commissioner on the Maryland Hospital Rate Setting Commission. We're excited to have him here today. We're going to be discussing Thursday's release of the Medicare Trustees report. Joe, do you mind starting off just giving us a little bit of background on the Trustees report in itself?
Thank you, Michael. The Medicare Trustees, those are the Secretaries of Treasury, Health and Human Services, and Labor, plus the Commissioner of Social Security, plus, in normal years, 2 public trustees. They produce a report every year, usually in March or April, that informs the public about the fiscal circumstances that Medicare and Social Security are facing. In the case of the report that was released last week, what the trustees reported was that one of the trust funds associated with the Medicare program gained 12 years. Instead of running short of cash by 2017, that trust fund will run short of money in 2029. Those are the numbers. That's the way it was reported. However, it's a much more complicated story.
All right, so it's a more complicated story. Can you go into that further? What's the significance of this report? Where does it play in the health policy debate?
Well, you know, it's an interesting problem because throughout the report, there are statements that indicate that not only does the expert who is responsible for this report, that's Richard Foster, the chief actuary for Medicare, not only does he believe that the assumptions he had to use to generate the estimates are unrealistic, but in addition, the trustees signed the report, and the report says the same thing. So the political appointees don't believe the numbers, and the expert who produced the numbers doesn't believe the numbers, and the reason is that the assumptions about how much money you can take out of the Medicare program are simply unrealistic.
So where do we go from here?
Well, that's an interesting problem. Health reform did a lot of things, but the main thing it did in Medicare was use up all of the cost-saving ideas that anybody's ever thought of. So if we're going to have Medicare be able to meet its promises to senior citizens in the future, we're going to have to find new and better ways of organizing the way Medicare pays for services and organizing the way the health system operates. Unfortunately, health reform didn't do any of those things. It treated Medicare as the fiscal blood donor. The money, theoretically at least, is gone from the program. $575 million gone. Senior citizens will feel the impact of that in January. They will know about it right away. They won't be happy. What we need to do is revamp the system. We need to put the program on fiscally sustainable grounds. And essentially what that means is giving people the option to select a plan that they want and give them the responsibility to behave responsibly and to pick up the costs of more expensive plans. We can't afford everything. We've got to give people access to good, solid health care in Medicare, but we have to also give people the opportunity to buy up if they choose to do so.
Thank you, Joe. Thanks for tuning in for this week's Ask the Expert series.